Good afternoon and welcome to the Assembly of Osteopathic Graduate Medical Educators AOGME webinar series. We're pleased to have you join us for this AOGME webinar on the ACGME's Med School portal featuring Dr. Sean Hogan. My name is Austin Wetmore. I'm the Program Manager for GME Initiatives at ACOM, and I will help facilitate this webinar. Before we get started, I'd like to review a few housekeeping notes. This webinar is being recorded. The recording will be posted on the AOGME webpage shortly. All webinar participants are in listen-only mode. If you experience technical issues during the webinar, please use the chat feature and we will assist you. If you have questions for the speaker during the webinar, please feel free to submit them through the Q&A feature at any time. If time permits at the end of the webinar, he will respond to your questions. I will now briefly introduce our presenter. Sean Hogan, PhD, is the Director of Outcomes Research and Evaluation at the ACGME. He is responsible for providing leadership for ACGME's research and evaluation agenda, with an emphasis on understanding the impact of accreditation standards, the transition between UME and GME, and the transition into unsupervised practice. Prior to joining ACGME, Dr. Hogan led research and evaluation studies at RTI International, focused on health services delivery, physician practices, health information technology adoption, and public health interventions for state and federal agencies. Dr. Hogan earned his master's degree and PhD degree at the University of Illinois, Chicago. Thank you again to Dr. Hogan for being with us today and for preparing this presentation. With that, I will turn it over to Dr. Hogan.
Thank you, Austin, and thank you everyone for having me today. So I will be talking with you today about our med school portal. Before we get started, I have a few disclosures for you. First of all, yes, I am an employee of the ACGME, and I was on the team that developed the med school portal for you. And most importantly, I'm here because I do want you to use it. So with that, we are let me tell you a little bit about the purpose of the med school portal. We came up with this to try to provide the UME programs with more feedback on how their alumni are performing in residency. The objective is for continuous improvement in the educational offerings that you all provide to your students. And we feel it's responsible, since we have all of these data, to put them to that sort of use, to provide them to you so that you can improve your programs. This is a public trust that we feel very seriously about, that we should put these data to good use for you. We established this in 2019 with input from both osteopathic and allopathic schools in the Chicagoland area. They advised us on the content and the information that would be that we had at our possession that would be of value to them. And we launched it the following year on the ACGME's website. So in order to get access to it, initially, we allowed only a single user to sign on, and that was usually the dean of the school. That included the logon information that was being shared around medical schools, so that others involved in curricular design and assessment could see the findings. Today, we now have as many as 12 users at each school. Those are administered through the dean's office. The dean can delegate a super user or administrator at the medical school to be the one who is responsible for assigning unique logins to each user, or to remove users when they leave the medical school. You will find the med school portal on the ACGME's website. You see on the right-hand side the image for ADS. That's our the data collection system. The menu will pop up for the accreditation data system. Make that selection, and that will take you into the med school portal. Once you're there, you'll fill in your login information in the yellow part of the screen on the left, and then choose the medical school portal page to open up the contents of the med school portal. When you get in, you will be asked to be a good steward. Every user will be asked to attest that they will use the data for the purposes that it is intended, for continuous improvement in your programs, to attest that you will not share them outside those needs and beyond those who have a right or a need to know. From there, you will be able to download the first year milestones of each of your prior years graduates. You will see information about their persistence through their residency programs, and you'll see the specialties that they have matriculated into. You will see additional resources around the milestones. And those will give you clear indications of how they are being evaluated on the 6 core competencies that are part of the milestones evaluation rubric. And from there, up until just this year, the specificity of the data was something we were working on very much because they were aggregated, they were de-identified, and that made it very difficult for the medical schools to trace the trajectory of individuals and to look back and see if their evaluations of somebody are congruent with that graduate's performance in residency. And now we are able to share row by row identifiable data about each of your alumni, provided that you have collected from those individuals consent for us to share that information with them. The data that we are able to share back with the programs will come from you attesting that you have received that student's consent. There will be a series of yes, no checkboxes next to each of your alumni, and you'll say yes. Student A said yes, student B said no, and you'll tell us who gave consent to share data. With that, we will be able to reply with information on those who you can tell us provided consent for itemized sharing of data. Those who do not will be aggregated for you. The consent we're asking you to collect, we hope that we want it to be active and not simply, if you fail to respond to this email, we will be assuming that we can see individualized data, but rather we would like the student to acknowledge that you will be taking this data from us and using it for its intended purposes. We will want you to hold those data. We do not have the resources to hold those data at the individual level. And we will not be auditing you. We don't have the capacity to go out and check on you to make sure that you have it. This is going to be on the honor system. But if there were to be an unwarranted breach of those data, we would expect that you have those evidence of that consent at your fingertips. And if there were a problem, the ACGME does reserve the right to restrict access to that information if there were to be a problem. Now, the way the data will be displayed to you, first you'll see the specialty choice. And in this example, you see the number of folks who go into each of the medical specialties that's listed on the left. The medical school graduates in the center of that frame tell you how many, for example, went into anesthesiology, family medicine, internal medicine, etc. And in the frame on the right, residency program count is the number of programs that they are distributed in. For example, let's look at internal medicine there, about a third of the way down in the specialty column. We have 50 in this sample who went into internal medicine. and they are distributed among 33 programs around the country. That's how you would read that information there. We also have, if you want to progress the slides, the milestones reports for the alumni. Here's an example from pediatrics. And in that frame, we show box plots that tell you the mean, median, and mode of the placement nationally and in relation to the graduates from your programs. It shows the outliers in those small circles above and below. And so it gives you a sense of positioning at a national level. And if you want to continue, the milestones reports will come out, and those will look a little like this. I know it's kind of hard to read on the slides, but I'll walk you through this. This is an example of milestones, and in this case, it's emergency medicine. The workbook that comes out will have all of the specialties. You'll see the names of the specialties on the lower part of that workbook, like you would see in any Excel workbook. You could toggle across and see emergency medicine, obstetrics and gynecology, dermatology, whatever program someone's in. The text in the middle in column D, the question text is the sub-competency in the milestones that the resident is being evaluated on. Across where it says resident 1, 2, and 3, that is masking the identities of individuals. If you have the proper consents, you will be able to see student Jones and student Smith and student Jackson arrayed across there, and in the cells are the milestone ratings. The milestone ratings, if you don't know, are along a continuum from 0 to 5, 0 usually meaning has not been evaluated yet, 1 being at a novice level of proficiency, 4 being a level of proficiency that we hope would be the graduation target, and 5 reflecting expertise. So you would see that on every one of these sub-competencies where your alumni are, how they are being evaluated by their preceptors in the residency program. So if we can continue from there, we are also providing you with 5- and 10-year lookbacks, and those come along with national comparisons. Those will be for our ACGME programs, of course, and you will see the outcomes of the residents. Did they succeed in their program and complete a transitional year? Are they still actively engaged in their training, or did they leave the program through a dismissal or withdrawal, or unfortunately there are some occasional deaths that occur, and you will see those numbers provided to you as well. The production for the milestones is a pretty big undertaking. The milestones for your graduates, for example, who graduated in 2022, we are just getting their first year milestones processed now. They come to us during the summer months when the competency committees complete their work. We construct the look back data after that. So that's in August that work is being done. Do our quality assurance on the data, scrub that from anomalies, and then we populate the med school portal in the late fall of the year. So now we will be releasing these data to you in just a few weeks, and those will show you the first year outcomes of your graduates from last year. So your 2022 graduates, you will have this information available to you in just a couple of weeks. The consenting process for you can be whenever it is works best for you. We think that a lot of programs will do their best if they ask their students for that consent early in their medical school training. So as soon as they're coming in that first semester, when they're signing all kinds of paperwork, that would be a natural time to be asking for that consent, to be collecting it when they enter into residency. But you can collect it at that time, or if they are on the fence about it, ask them later in their studies and right up until the time they leave. You can collect that whenever it works best for you. Now, let me offer you some examples of how we are using these milestone data now, and that might frame the way you think about using this. Right now, I am working with a study team led by the University of Illinois Chicago and the University of Cincinnati's medical school. We are working with 6 medical schools, both osteopathic and allopathic, public and private, across the country, to better understand how UME evaluations are predictive of the evaluations that an individual will have when they get into their residency program. So we're aligning those with their first year milestones. This is 4 cohorts of graduates are being studied here. And we're trying to see if we can identify those who will be outstanding no matter where they go, or identify those who, if they were showing signs of difficulty during the medical school, if those remediate themselves or whether they persist as they get into residency program. And like a lot of studies, we are looking for any discrepancies that we can detect along the lines of demographics like race, sex. The project we're working on is going to be looking at the preclinical course grades that the participants will share, their skills evaluations, leaves of absence awards, and the demographics. This is a very involved process. It took us about 18 months just to get the data use agreements all lined up between the 6 medical schools and the ACGME, and we got our last signature just today, as a matter of fact. So now we will be using these data to go forward with these studies, and in the next year or so, we will be presenting these in various forms, with the ACGME's annual education conference and elsewhere. So with that, I think we can take a pause and see if you have any questions about the design and the access to the med school portal.
Yeah, thank you, Dr. Hogan. So we had one question come in live. So it was, do students have to opt in to be included, or is it automatic that they're included?
It is not automatic that they will be included. The medical school should ask and receive the consent of the student.
Thank you. And
But for aggregated data, yes, you could have aggregated data that we can share that does not require the individual's consent. But if you want this at the individual level, we will need the consent of the graduate to share that.
And so after giving consent, are they able to opt out later on?
Yes, just like you do with other human subjects work, that the individual does retain that autonomy.
Awesome, thank you. So one other question is, do all faculty have access to the med school portal?
Right now, we have a maximum of 12 individuals at each institution who can have individual sign-on permissions. I didn't say you should be sharing them, but some people have. The site administrator for each medical school will has the prerogative of deciding who in the medical school has access. If we start to hear requests for greater and greater numbers, we can probably start to increase that number if there's a demand for it.
And so how can faculty who do not have access sign up to have access or request access?
They can work through the dean's office. The deans will have the prerogative to name someone who would be the site administrator for the medical school, and that person would grant the permissions. If you've maxed out on the permissions, that person who is the site administrator should be able to share information with you if the medical school decides that you're authorized to see that kind of information.
One other live question that came in is, does this program or the med school portal, does it distinguish between a resident doing a 1-year PGY1 surgery versus a categorical 5-year surgery program?
That's a really good question. Not right now. It will tell you only that the person is PGY1 or transitional year will have transitional year information.
So are all students from a specific medical school, like in that cohort, are they required to participate, all students or none for the medical school? Or is it based on individual student?
Well, if you mean everyone who goes into residency in an ACGME accredited program, the programs are required to evaluate residents using the milestones. They can use any evaluative tools they want, but as a condition of their accreditation, they must use and report to the ACGME progress of each of the residents along the milestones continuum. The only exceptions would be, if somebody's out for a medical leave or for whatever reason, and when they return, they pick up where they left off on the milestones reporting. So we compile information on virtually everybody who is in a residency program throughout the course of their training. So there's no excuse not to have it. And so we can give you the aggregated data without any problem. The only challenge would be without consent, it would be aggregated. With consent, you can have individualized data.
And similar to the question about this surgical specialty, so does a 1-year transitional year show up?
Yes, those will be in there as a transitional year. On the tabs that we showed you for the specialties, you will see a transitional year option in there that you could click and see who's in a transitional program.
And how many people can sign up for access or per medical school? So can people from GME and UME sign up?
Oh, that's an interesting question. This program, the med school portal, is designed for the UME community. The GME community, the program director for sure will have the access directly to their residents in that program.
And we have a couple questions about the consent. So is there some sample language that you have to provide asking for consent, or like a
Yes.
sample consent form?
Yes, and I can send that to you, Austin, and you can forward that to the audience if you want.
Okay, that sounds good. And then, so if someone at a medical school doesn't know whom at their school has access, how do they find that out? Do they ask the dean's office, or will your department at the ACGME like tell them where to look?
We can do both. If you could start with your dean's office, that would be who we do our most direct communication about this with, is the office of the dean. If there's transition or whatever in your organization, what have you, feel free to reach out to us and we can tell you who we're communicating with.
And so what differences in evaluation may be used for DO students versus MD students or residents? Excuse.
Could you say that again?
What differences in evaluation may be used for DO versus MD residents?
We have osteopathic recognized programs. I don't know if that's exactly what you're asking, but in the osteopathic recognized programs, there are milestones that are particular to the osteopathic practices and principles that both allopathic and osteopathic school graduates are evaluated on when they go into an osteopathic recognized residency program. And so you would have that feedback there.
Okay, so can the med school portal web platform integrate with the existing platforms of the medical school? For instance, does it have links or integration to UWorld?
That's an interesting question. Not to my knowledge. And I don't know the potential for, if you're looking for something like a single sign-on feature with your organization, for all of the web-enabled tools that you might have at your disposal. To my knowledge, we are not yet ready to do that.
How are the data from residencies most useful to current preclinical students? And are these data qualitative or quantitative?
The qualitative data include the specialties that people enter. Most of the data we are offering is quantitative in the sense that the milestones are marked on a numeric continuum. For incumbent students, the utility of these, be very careful not to share identifiable information with students about their recent graduates of the program. Instead, I would share with them more aggregated data about students and how they are performing in residency to protect the identity and the privacy of those individuals. But I think that would be up to the medical school to decide how to use that in counseling students about specialties that they might be well equipped to enter into, or programs that might be aligned with that particular student's interests.
And so how would this make teaching more effective for someone who also teaches basic science such as microbiology and pathology?
That's a good question. I think with the milestones, we have the medical knowledge milestones that are unique to each of the specialties. But I think those could be informative to the basic sciences in terms of how well people are generally doing in particular areas of core medical knowledge. And you can see by studying your program's graduates, if there's particular areas that they seem to be struggling with or seem to be excelling in.
And so related to the multi-site study, are you planning on including more sites in your current study?
I would like to grow that, and we have talked about that as part of the future of this study. To be on the safe side, I'll say that is to be determined, but there's a consensus among us that we would like to keep that work going and continue that consortial work.
Okay, so that was all the questions that we had. Does anyone have any more questions for Dr. Hogan?
If any questions do occur to you, my email is on the slide here. Please feel free to contact me directly.
Okay, I think we'll wrap up early then. Thank you, Dr. Hogan, for this great presentation, and to all who joined us. As a reminder, a recording of this webinar and slides will be made available on the AOGME webpage shortly. If you have any questions, please contact us directly at aogme@acom.org. This concludes our webinar. Thanks again to everyone who joined us, and have a great evening.
Thank you very much.